It is lunchtime. 52-year-old Rose Teresa is crying with tears rolling down her face because she's hungry. She can't talk or walk. Thankfully, her lunch arrives shortly and she stops crying. Later, 8-year-old Madrin Namugera is also served. She can't use her hands, which is why she uses her feet for most activities including eating. Madrin is trying to eat the last pieces of the watermelon that are part of the meal she was having for lunch on a Saturday like this one. Before the pandemic hit the entire globe, they used to have at least an egg and also a banana, or sometimes rice and beef on such a Saturday. But her future and others remains bleak because it's becoming very hard day by day for the caretakers to provide the decent meals they used to enjoy.
We used to go out every day, buy food in the markets, in the shops. As I said, they have special diet, these kids. But now we cannot do it. Even we are caught out of hand. The stock we have so far within these 4 or 5 days is out. We don't know what's the next.
The children with special needs sleep in this dormitory. They need special meals, and ideally, each child should have a dedicated caretaker to feed them. However, due to the lockdown, many of the volunteers that usually help out cannot come to the mission.
They can't bathe themselves. We have 13 volunteers who have been coming to help us. But out because of the transportation and the directives from His Excellency, we managed to get only 2 volunteers who stay here. Can you imagine working with 150 kids, having 2 matrons?
The mission does not take care of only children with special needs. Some of the children at the orphanage would ordinarily be at the boarding school, but since the schools are closed, the food costs have shot up, yet there is less money coming in from the donors.
We were founded from Jamaica, that's where we get our money. But as you know, as an institute, we operate on a quarterly basis. So we got caught up before even the quarter has begun. So within the process of preparation, we are already in the system of locking down. We are not ready for this. We were not ready at all. Even the funds have not come yet from Jamaica.
They also have a challenge of garbage disposal.
We are appealing KCA to come to our rescue if we can be helped by picking the garbage we have in our home so that we can, protect the kids from other outbreaks like cholera, which God forbid.
Although the mission has an ambulance, it is increasingly becoming hard to take the children to hospital.
We have missed some appointments because of the movements. Having ambulance itself cannot help us. We've been using 4 to 5 vehicles to move around to make sure all our services are met.
So what is the way forward?
We believe in divine providence. God will move the hearts of many who might be listening at this time to come to our rescue. And also we pray that the government will reach out to many, not necessarily as Mission of the Poor.
They also have another orphanage in Busega, the Bethlehem Home for Boys, that caters for 135 elderly persons, children with special needs, and other orphans. All the 245 children and adults do not know what tomorrow will bring. Sudil Biarhanga, NTV.